Maybe we can start by just um, hearing about Tyler. Tell us about Tyler, if you don't mind.
Well, it brings a smile to my face. Tyler was a great kid, great son. We're really proud of him. He didn't want his life to be defined by the disease of addiction, but unfortunately it was in the end. Leading up to that, Tyler was just a normal kid. And these stories that end in tragedy are hard to live with and hard to take, but they do happen all too much in our society today. He started to experiment when he was in middle school with the pot and the alcohol, and Jeannie always talks about the fact that most kids do, and the statistics show 8 out of 10 do experiment at that time. At some point, he moved on to opiates, pain pills. I don't know exactly when, but I do know that when he went off to college, he had kind of free reign to not as much supervision as he had before, and I think that's when he really got involved with these opiates and involved with them. Anytime he came to us, or anytime we found out, he always wanted to get better. No one chooses to become addicted. They make some bad choices along the way with some experimentation, some other things. But he was an athlete. He played on a state championship football team. Was well liked by his teachers and classmates, and witty, funny.
What were the circumstances that led to Tyler's experimentation with pot and alcohol?
I think it was peers. I think that our society looks at it as a ritual of that's what teenagers do, and I think he was probably doing some experimentation on the weekends. He knew that he was accountable when he came home and went to other friends' house. We would call and verify that he was going to be there, and I think maybe since this was easy to get to and there was no odor, that the kids were a little bit more likely to do this on the weekends. We didn't have opiates in our house for no other reason than we were healthy. But I think some of the kids were able to get them from other places.
How did you figure out or find out that he had gone from pot and alcohol to opiates?
When he graduated from high school, he went to Wesley, and that's where he kind of, like Don said, he had a little bit more free reign. He wasn't responsible to check in with anybody, and he also had wisdom teeth pulled that semester. When I took him back to get his wisdom teeth out and we had a checkup, I was in the room with him when they asked him if he needed more pain medication, and he said yes, that he was still sore. I hadn't known about the first pain medication. I think he had already been experimenting with it, but I think that that's when it really took off. His addiction was when he went to college and pretty much partied himself right out of school.
Did he ever tell you where he got the opiates? Was it easy to get opiates in school? Was it
He said it was easy to get. You could get anything anywhere. It didn't matter.
Anything anywhere?
He said it was easier to get than you would have thought. He worked in Pike Creek. He had grown up in Hocus, and he said you can get it anywhere. He said it's not the poor kids in the inner city that have this stuff. It's the kids whose parents can afford to give their kids money to go to a movie or go out. And he said it was available, readily available.
So he got some prescriptions from the dentist, but those you think were just in addition to what he was already able to get elsewhere?
Yeah, I don't know. I kind of feel like I know he was experimenting in high school, but I feel like his addiction took off when he went to college. Yeah. And that's when he got the 2 prescriptions of painkillers that we know of.
Were there any signs that you could identify that made you think that his addiction problem had worsened or had progressed?
I really thought it was drinking and pot. I had no idea about this opiate problem. It was in March of 2008. We had been fighting with each other because I felt like things weren't right. He was so intelligent and not living up to his potential. And
Meaning that his grades weren't very
yeah,
well?
well, at this point he'd stopped going to school,
Oh,
and he was working, and he was getting awards at work for
Well, at this
Employee
point,
of the Month. And
well, that was it after he came back, but he approached
no,
us.
that wasn't before he went. But then in March, that's when he told us that he had a problem, and it was with the opiates.
Mhm.
And that was, I think, the first time we realized how big this problem was.
Mhm.
So therefore, we bought him a one-way ticket to Colorado, and he worked on his addiction and was okay for about a year and a half out there.
What prompted him to come clean when he did about his opiate problem and addiction?
He said this isn't the life that was for him. He didn't want this kind of life. He knew that he needed to get away from Delaware and away from the people he had been with to be able to break free of this.
Mm-hmm.
And he did. He lived out there for a year and a half and told us he was okay here for almost a year before he relapsed again.
And where do you think he got the majority of his opiates? You told us about the prescription that he got from the dentist, but it sounds like he had already been hooked on the opiates. And what do you think was his main source of those opiates?
Not his prescription.
Not his,
He
not
did
his
have-
supply.
Not his supply. He did have ADHD. He took Adderall for that, but he didn't take it willingly. He took it when he knew he had to study. He knew he had to write a paper. He would take it then, so that he would concentrate.
We had pretty good control over
Yeah,
it.
and we had the prescription. Don would give it to him on the way to work. They would drive, from Hocassin to Caravel, and he'd give it to him on the way there. And the only time he really took the Adderall was when he was trying to study. He needed it for that. Otherwise, he didn't like the medication.
We're not 100% sure when the pills turned into something else. I think he had access to the pills pretty easily for a long time, 4 years or so off and on. But when he didn't have access anymore is that when he turned to the heroin. And of course the heroin was cheaper and easier to get. And I think clamping down on one thing has kind of raised another
Right.
issue and another problem in the same regards. But that doesn't mean we don't cut down on this pain pills. And we've talked to so many people in our group that had a car accident and hooked on pain pills. A good friend of mine, influential person in the city of Wilmington, had a knee operation. He became addicted, and he knew he had to get off, and he did in a very short period of time. But when someone gives that prescription, it should be in the front of their mind that this is dangerous. Either if it gets in the wrong hands or is misused by the person I'm giving it to. So I'm not sure all the medical aspects of it. I know that I had a situation with some pain the other day, and I was offered some pain pills. So I really don't want any. He says, "Well, take them in case you need them." And I got 20 pills, and I don't know. It just seemed like maybe that's the least that they can give, and maybe that's a normal amount to give. I don't know, but now there are 19 pills at my
Sitting
house.
around in your house.
In my
yeah.
house, and I'm going to have to run over to.
Yeah, I mean, I think
to the
that
take-back center.
that is a perfect example of a reflex in prescribers of giving a more than adequate amount of pills to cover whatever might occur after a minor procedure. We are trying to encourage prescribers to rethink that and move away from that so that less opiates will be prescribed and be available in households because of that habit. What do you think led to his relapse? I mean, was he having ongoing therapy of some sort to, like Narcotics Anonymous? Was he going to that or anything like that?
He wasn't, and I think partly why he wasn't going was because he didn't want to be associated with any of it. He wanted to be normal. He didn't want people to know about it. I'm sure his peers probably knew. Most of our family did not know. He was not very proud of it. And I think that he wanted to call himself cured and be done with it. And he did okay for that time he's in Colorado, but he was going to meetings then, and he had a sponsor. And when he came back here, I think he thought, I'm cured, I'm just going to move on with my life. And I'm not sure exactly what the relapse.
Yeah.
But we
also during the time he came back, he got associate's degree from Wilmington University, and so he did start back up to school. And I think as a parent, you want to see your child be successful and have plans and ability to move forward with their life. And those are things that you and I might realize are successful, but you have to take care of your health, and you have to be over that addiction before anything else matters at all.
Right.
And I think he knew that he wanted to be successful and wanted to have a job and wanted to move on and have a good life.
Do you think he understood addiction as a lifelong disease?
I don't think that he did.
Yeah.
I don't think that he did. I
Well-
really don't. But see, after
Or he just didn't believe it, maybe.
Yeah,
after the big one, I mean, he went and worked at the beach for that one summer. And when he came back, we found out almost immediately that he had relapsed, and he's ready to fix the problem. And he went to a methadone clinic, and I felt as though that the counseling was not what it should be. The observation of the amounts that they were given and exactly what was happening, I think, come in, get your methadone, and go on your way. And that worked okay for about 7 months. But then the problem manifested in the fact that he then started using heroin. So now he's getting his methadone medical treatment,
And
taking
on
heroin.
top of that.
And now when we try to deal with that, we have a double problem that is requires a medical detox, which was not easy to find.
Right.
It was very hard to find. It was very expensive.
What do you mean by it was hard to find? They didn't. There weren't the facilities here in Delaware that would
There's
handle
nothing.
that.
The
I mean, there
first,
are like Kirkwood Detox and
Well, they would go through a detox, but in order to detox from
methadone.
methadone
It's a long
and
time.
heroin,
Yeah.
and the amount of methadone he was taking, even though I don't think it was an exorbitant amount, it was enough that it had to be a medical detox. So when he went to Florida to detox, he was in the hospital twice. It was $1,000 a day, and it took him 11 or 12 days for the medical detox to be completed. And anytime we talk to someone, because of the number of milliliters that he was taking, we said, no, we can't detox him here. So I think that created the issue and the problem in finding a place that could do the job.
and none of that was covered by insurance. So, we were able to send him there, but it was difficult to send him there and spend that sort of money. But what are you going to do? It's your child.
So what happened to him after detox?
He went to a 28-day rehab.
Here in Delaware?
In Florida.
In Florida.
He came back from rehab in Florida. He had a lapse one day, let his Oxford House president know that he had lapsed.
He was living at Oxford House?
Yeah. The counselor at his rehab, and this was the first official rehab he had ever been to, suggested that he not move home. Going back is what they said. So they suggested he move to different living circumstance different than home.
Mm-hmm.
And he had the lapse. He checked himself into Meadowood, and they released him after about 4 days. And he knew he was still struggling. And he called. He was a full-time employee at the bank, had Blue Cross Blue Shield because he was under my insurance because he was still 24. He found a place that would take him in Media, drove up to Media. He got there to find out that because he had just finished a rehab, he couldn't stay. So he was turned away by insurance,
Is there a limit to the number of times you can go to rehab in a certain period of time?
apparently.
So he couldn't go. He didn't go to that detox or that rehab.
No, so he just kind of like white-knuckled it for a few weeks. He joined a gym, he went to meetings, but then he relapsed again and had his first overdose. And was on life support for a couple of days, which, ironically enough, his insurance costs a whole lot more for him to be on life support for 4 days than it would have for a rehab.
Yeah.
And was that his death or
No, it was his death.
Yeah.
He went to a motel in Newcastle.
Okay.
And actually, he had arranged for someone to pick him up the next day to take him to the detox center. But they didn't. He didn't know where he couldn't tell the person where he was.
Mm-hmm.
And when he didn't check out at the appropriate time, proprietor found him, called 911, and they took him to Christiana. And we got there. The doctor told us he wouldn't make it through the night, but he did make it for another 3 days.
I think part of what we're trying to do is talk about it because it's empowering people to start ending the stigma. Tyler being one of them, he didn't want to go seek out help. He didn't want to be that person sitting in a meeting in church. He wanted to be normal. He kept saying, I want to be 100% drug free. He didn't want a maintenance. He didn't want anything more than to be just like what everybody else appeared to be.
Mm-hmm.
And it's not what everybody is, but it's what they appear to be.
Mm-hmm. Do you have other children, and how did this affect sort of the whole family?
It's been hard on them.
Well, it's been real hard. The siblings take it just as hard as the parents and the grandparents and the other relatives. When you see a life that's snuffed out in the prime, and it's happening to so many people now, young age. Even though as you described, middle age and older are also facing the issues, but some of these young people with their lives in front of them that go, it's just devastating to a family to know that's what's happening. You know, no more Christmas, no more birthday, no children, no graduations, and we're very fortunate to have a close family and very supportive family, and they all pulled together for us when we had our very first meeting in TAC addiction, and it's grown quite a bit from family members, but they're still there, and they kind of see the difference. The statistic I've heard is that 1 in 10 that need help get it, and mostly it's because of the stigma associated with the disease of addiction.
And there's always the question of, what could we have done differently to prevent all this? And you kind of probably beat yourself up a million times, but at the end of the day, addiction is really being understood as a real disease that has to have constant attention and treatment, and it's not any one thing you could do differently that would have made anything change necessarily.
You're exactly right. You're always thinking about what if you did this, and if you had done that. And no one writes a book on how to be a parent or how to treat someone that has addiction, and what even pushes them that way. But I feel as though we provide a loving environment, and you had full support of a family. And at some point, you decided to use some drugs, and it got out of hand. And in his case, it
Cost him
killed
his
him.
life.
Yeah.
And we did have me more than Don, but I had a lot of guilt. And Tyler from the very get-go when he went to Colorado, and he told me constantly that it was not our fault. And I think what we learned is that he was a really good person with this disease that may have caused him to make bad decisions at times, but he was just one of the kindest people that you would ever meet. He really was affectionate and caring, and he was, I guess because he was the youngest, we were especially close to him. He called us every single day, or he answered the phone when we called him, so it's hard to go from every day of talking to him to never talking to him again.
You know, I've been sort of focused on this problem for quite a while now, and what advice would you give prescribers to help them minimize the prescription drug abuse problem?
I just think they have to realize when they write that prescription, they're handing a gun across the counter to them. It's like handing a gun to them. You don't know whether it's loaded, but it's a dangerous thing that you're giving out. And I don't know, maybe I don't know if there's such a thing as a 5-pack, or just to limit in some way what you're doing. And I'm sure that there are terminal people that need those drugs, and it's certainly appropriate that they get them. That's another thing that we should have some research to look into exactly what you're talking about, and what kind of drugs are we giving to people that are terminal, and what kind of pain medication do we need to give people that have their teeth out, or that have a knee fixed, or are in a car accident, and these people that come through, and I think you've heard them at some of our groups. I would tell these doctors they have just got to be mindful of the fact that this can be very dangerous. These pills can get into the wrong hands. They can be used incorrectly by the people you're giving them to, and know that it's a big issue and a big problem.
And I don't think it's being done intentionally by anybody, but I think that it's probably hard for the doctors to see, Tyler the banker, and believe that it's hard to imagine that he was an addict. Like,
right.
Half of our family had no idea. And I think that for a doctor to see a well-dressed young man put together come in and saying he's having pain, they take it that way, because I think we all have like this vision of what an addict looks like. And I think that makes it more difficult. This past summer, somebody in our group was in a car accident, and he had shoulder pain, and he told the ER when he went in he couldn't have an opiate, and 3 different times he was offered pain medication, but nobody, the whole time he was there, nobody ever took an x-ray or a CAT scan or whatever they take of the shoulder to find out a week and a half later, when it was still bothering him, that he had a tear. So the concern was, I was offered an opiate 3 times after I told him I couldn't have an opiate at the ER, which it could have been a weak moment for somebody who was having pain to say, yeah, I'll take an opiate. And I think a couple weeks of being in pain is better than a lifetime of pain, because even those who were in recovery, and maybe that was part of Tyler's downfall, is he just wanted to write himself off as being normal, and like everybody else it's a struggle. It's an everyday effort for a person who's addicted to stay in that mindset. Even though they look like they've got it together, it's a real effort and work every day of their life to stay on that same path.
Right. Anything else you want to tell healthcare providers related to Tyler's experience, or what you all have been able to gather and learn about in your efforts with attack addiction?
Well, I do think that they've made some strides in the prescribing and the monitoring of it. I think it probably needs to go just a little bit further. I think this that you're doing with some education is important. If we educate the doctors, we're talking about educating middle school and high school kids, but when the doctors have that education and are aware of this is complete pain that comes from an overdose death situation, it should register with them that, hey, I have a responsibility here, and I got to make sure I monitor it correctly.
Right. So tell me about attack addiction and the groups you work with.
Well, that's been a real change for us. We decided, I'm standing looking at Tyler in his life support, and I said, do you think I should take a picture of this? Maybe someday I want to use it in a talk or a conversation.
This is how you're remembering and honoring Tyler.
This is how we are remembering and honoring him. And in addition to that, we realize the pain, if we can stop other families from having to go through that pain, that's another goal that we have. And so I took the picture and put a little presentation together, and if anyone asks, I go to schools and give that presentation. I take one of his high school buddies who was in recovery, and he talks to him a little bit down at their level. The old guy bringing in the message isn't always as good, but they do listen. We've done a number of things. We've supported some legislation and tried to work on that with the 911 Good Samaritan law, and also the naloxone bill that has gone through. We're right now planning an event called we call Passport to Awareness, which is on the National Make a Difference Day, October 25th. And we have a number of things going on with that program. So we want to bring awareness. We want to bring education. We also try to help those that are in recovery. We supported some Oxford houses. We get calls frequently about people that need some kind of help. We've made some contacts with some of the people down in Dover in the state that can help in these situations, and they do. Even someone that has been for the last year and a half trying to find out all the things that are available, I'm still learning about new things. I think the information is not getting out to those that need to hear it and need to know about it. And so I think that's another thing that we want to work with, bring awareness and remove the stigma. Those are the two keys, I think. We can't tell a person who comes to us for help, come back next week.
Right.
We can't tell them right now we don't have a spot for you.
You have one opportunity.
We have to give them an alternative. Okay, your insurance isn't any good, but go here and do this. This person can help you. And there is support out there, and we have to get that information and that word out to those people.